Hello. Good morning, everyone. Sorry, we're running a few minutes late, some technical difficulties. This is Cindy Rubin. I am a pediatrician and breastfeeding medicine specialist, and I practice in my little tiny practice called In Touch Pediatrics and Lactation in the suburbs of Chicago. And today I have with me Dr. Taiwo Durowade. Dr. Durowade is a board certified OB-GYN who has been practicing in the South suburban area of Chicago for the past 5 years. Dr. Durowade is interested in preventive medicine because it helps women lead healthier lives. She started her own private gynecologic practice in January 2022 called Darter Gynecology, where she provides personalized care to the women she has always wanted to serve, women with whom she could relate and whose issues resonated with her. Dr. Durowade believes information is key, and she enjoys educating her patients, which is why she created a show titled Uncommon Knowledge on her YouTube channel, where she shares information that should be common but remains uncommon. A very, very important thing to be doing in this day and age, especially in women's health, where unfortunately it has not been prioritized and people don't know stuff, right? So welcome, Dr. Durowade. Good morning. Thank you for joining me.
Thank you for having me. This is exciting. I'm very excited.
Absolutely, absolutely. So, let's start. So first of all, we will talk a little bit more about this at the end of this piece, but Dr. Durowade actually has an open house tomorrow that there is information on my social media and certainly on Dr. Durowade's social media. So this is definitely something that you should consider going to. We're going to talk a little bit today about how she uses laser therapy to treat her patients, and tomorrow you can they see it in action?
Yeah, they can. Well, not in action.
Okay.
But they can see it, yes.
Live and up close, yes,
Yes,
in person.
yes.
All right. Well, tell us a little bit about your practice and how you decided to add the laser therapy into your practice.
Thank you so much, Dr. Rubin, for having me. This
Absolutely.
is exciting. I love the topic you chose. I suddenly got all these jitters when I saw the topic, and I was like, okay, I'm excited to talk about it. So,
Good.
my practice is called Data Gynecology, as you introduced, where I mostly focus on gynecology. So, women's health, anything outside of pregnancy, I can take care of. Um, as you said, started in January 2022. I found that I enjoyed the consultation piece, coming together, learning about your concerns or my patients' concerns and coming up with a plan together. I find that it helps engage my patients. They stay engaged through the process. Like they know that, okay, we've tried this and it hasn't worked, so we're going to go to this. So they know their options and they feel well informed. And so they feel like they're making the right decisions on their health versus the old times where they would just say, this is what's available for you, what you're doing, go. So a more personalized, more intimate. A lot of my patients describe coming, people get anxious when they're going to the doctor, but
Right.
over the past year that we've been open, we've been able to establish a more intimate environment. So people just feel like they're visiting their friends, they're just here to chit chat and figure out what's wrong with them. And so I really
Yeah.
enjoy that consultation part, that discussing part, and then coming up with the plan together part. So reason I
Sounds
added
lovely.
thank you. The reason I added laser therapy was because there were people I couldn't help. Um, After going through, their concerns, then I would say these are the options available, and they would just be either not the right fit for it based on their medical history, or they tried it and it just didn't work,
Hmm.
or after discussing risks of some medications, they don't want to risk it. And so I'm like, I have nothing else to help you.
Mhm.
And that was a little bit I want to say, dissatisfying. And
Yeah.
so I started looking into what other people, I've heard of med spas, I've heard of laser, I've heard of vaginal rejuvenation and stuff. So I started looking into it to see, okay, is this truly, based in science? Is this truly beneficial? Is this going to work? Am I going to get the results my patients are looking for with this? And I spoke to a lot of physicians who are actually using it in their practice, and they gave me their patient testimonials. And so I was like, okay, I have one more thing I can give you to help you. So I
Yeah.
decided to add the vaginal laser therapy, specifically vaginal laser therapy, into my practice. And just so I can get people to understand what it is.
Yeah.
Um, it's basically for women who are having vaginal issues, whether
Okay.
it's dryness, whether it's incontinence, whether it's meaning urinary incontinence, whether it's recurrent vaginal infections, recurrent urinary tract infections, pain with sex, vaginal looseness, like laxity as well. So it could be a young woman who just had a baby,
Hmm.
postpartum, noticing some incontinence issues, freaking out because I'm 31. What is this? This
Yeah.
is not supposed to happen. Or menopausal women who maybe have a history of breast cancer and cannot take estrogen and are suffering. They've had chemotherapy, um, or women who've been treated with chemotherapy and their ovaries have been affected and they don't have as much estrogen anymore and are suffering from vaginal dryness and vaginal pain because of the
Okay.
loss of estrogen. So this treatment, non-hormonal, non-invasive, proven to work to fix all vaginal issues. Um, all vaginal issues. Yes.
Wow, that's pretty incredible.
Yes, yes.
Yeah.
And it's amazing because the patients that have started doing the treatment, I always call them the day after to say, so have you noticed anything? What do you feel? And one of my patients was walking out of the door and was like, is this supposed to work this fast? She said the words she used was she felt more fullness, and this was an older lady. So she said she felt more fullness in the vaginal area. And the other thing we're noticing is increase in sexual pleasure.
Hmm.
That's something I'm hearing from everybody that I call. And, maybe they don't want to share that at the beginning. And then I probe a little bit and say, so how is the experience? Is there any different? They're like, yes, I do notice some improvement in pleasure. So I'm really
Interesting.
excited and that's one of the, reasons that I added that on as well. Because there are some women who suffer from low libido,
Hmm.
but maybe they can't take hormones or they choose not to take hormones.
Hmm.
But if the sexual experience is improved, if it's
Hmm.
not painful, if it's not as uncomfortable, then they're more likely to be interested, more
Hmm.
likely to enjoy it. And that in
Right.
turn can help their sex drive.
Right. That's
Yeah.
amazing because it's such an important thing and it's something that people don't talk about and are
Right.
embarrassed about and feel like maybe there isn't anything that can help them.
Right.
So it's just something we
Right.
have to live with. But it's
Right.
really, I mean, sex is an important part of our lives, right?
Absolutely. Absolutely. One
And
of my patients was like, oh, at my age, I'm like, at your age, at any age.
I hope so.
Yeah.
Yeah. And
The
so
quality of
it's,
life issue.
yeah, I mean,
Yeah.
it's just such an important service that you are providing, just another option that people can have.
Mhm.
So how does it work?
Great question. How does it work? So, I'm sure most people or most women know what an ultrasound is. And there's abdominal ultrasound where they put a little probe on your belly, and there's vaginal ultrasound where they put a probe inside the vagina. So the machine comes with a probe, but it looks like the vaginal probe of an ultrasound.
Okay.
And we insert the probe inside the vagina, and I press a foot pedal that releases laser energy. So I would insert the probe all the way into the vaginal canal, press the button, and then rotate it 360 degrees. And then
Okay.
I'll pull back 1 centimeter, rotate it 360 degrees again, up until I treat the entire vaginal canal. And we do
Okay.
that for about 2 passes. And what the laser is doing, the laser energy is doing, is causing microscopic injuries in the vaginal wall.
Hmm.
So the body thinks that there's an injury, we got to go repair this. And so it rushes blood flow, rushes all the nutrients for repair, all the, what are those macrophages, all those things that help
Mhm.
repair any type of
Mhm.
injury in your body. And then that builds up your collagen. So for women who are feeling
Oh, interesting.
looseness, it feels
Yes.
more it feels more elastic, more tight. Um, for women who are having dryness, because there's increased blood flow, it brings in their lubrication back.
Okay.
For women, it also helps the nerve endings, so it's more sensitive, which is why women feel more increase in sexual pleasure because of that.
Mhm.
And it also, because you're rejuvenating it and you're bringing blood flow and collagen, for women who have recurrent vaginal infections, it helps to repopulate the good bacteria, so the lactobacilli. And so the brain is kind of responding to an urgent situation in the vagina.
Right.
Because the ovaries have, given up. They're not making estrogen anymore. And I always say this, the vagina needs estrogen.
Yeah.
So whether you're breastfeeding and your estrogen is low because you're breastfeeding, you need the laser therapy. That's what's going to help you.
Okay.
Whether you're in menopause and your ovaries have shut down and are no longer making estrogen, that's where this laser therapy can be helpful. Whether you have um, unfortunately cancer and you've gone through chemotherapy, and we know chemotherapy can kill the ovaries and therefore reduce your estrogen, the laser therapy is an option for you. And so it's respond, instead of the vagina sort of being forgotten because everything else in your body is important, your heart, your brain, now it's responding to this urgent situation in the vagina and rushes blood flow there and repairs it. It's a vaginal repair that's going on. And so you have all these added benefits afterwards.
That is fascinating.
I know.
Wow. Wow. So it's really, it doesn't matter which of those problems you have, you
No,
essentially treat it the same way.
exactly, exactly.
Yeah.
Because
Yeah.
most of them kind of stem from the same issue.
Mhm.
The postpartum, there's all this fascial tearing and trauma from the delivery of the baby. And pelvic floor therapy was what I would offer people in the past, and I still offer people pelvic floor physical therapy. It's like, exercising the muscles of the vagina to gain your strength back. But
Mhm.
I was finding that, a few of my patients will say, I forgot to do my exercises. I was really stressed out at work. And so the incontinence came back. So it's like a muscle, if you don't work it, then you sort of lose the benefits. That's the advantage laser has over the pelvic floor therapy. So I still combine both in some women. Um, I wouldn't just say, oh, don't disregard pelvic floor therapy. It's still
Right.
a vital part of, especially for women suffering from prolapse. Now, there is more collagen and more strength in the vagina, but if it's falling already, we still need the pelvic floor therapy to build up the muscle there. So I would
Right.
combine that in some situations. And so if it's recurrent urinary tract infections, interestingly, people don't associate it with vaginal dryness. People don't associate it with loss of estrogen, but it's
Mhm.
literally because of the loss of estrogen, loss of support, loss of strength. And
Mhm.
so women who have UTIs or bladder infections after sexual activity, especially, this is a amazing option for them. And they don't have to be, I would treat that with vaginal estrogen in the past. Um, and there's some women who would do very well with the vaginal estrogen. Some women will complain that it's messy and it comes out later, and their partner is freaked out because they're like, what is this white thing coming?
Yeah.
Well, trying to meet the needs of everybody.
Right.
So regardless of the situation, basically, urinary tract infections, vaginal infections,
Huh.
urinary incontinence especially, it's really dramatic, the urinary incontinence resolution that people get. And it wasn't for urinary incontinence in the beginning, it was for dryness. But women who had urinary incontinence started noticing that their incontinence symptoms resolved once they had the therapy after like the first treatment. And so that's when we started, well, the people who made the machine started marketing it as used for urinary incontinence as well. So anything that comes from the loss of elasticity or loss of estrogen in the vagina, the laser treatment can help to reverse.
Wow. That really is incredible. Yeah.
I get excited talking about it.
Yeah, clearly. So, does it hurt?
It does not hurt. So um, the younger women, the younger women don't really feel anything. Like, I feel a twinge. The
Okay.
older women, the discomfort comes when you first insert the probe because it's
Okay.
dry. We don't
Yes.
want to put too much lubricant on the probe because we don't want to dilute the effect of the laser. So we
Right.
put just a little bit of lubricant. So when I first inserted, they're tensing and we go through a few relaxation movements to relax them. And then when we press the laser button, they feel maybe, oh, it's a 3 out of 10, it's a 4 out of 10, but they're able to tolerate the treatment. But what happens is that after that first treatment, there's repair going on. Their next treatment is more tolerable because now we're not
Okay.
starting from the, you know,
Right.
low estrogenic state or hypoestrogenic state. The younger women don't really feel anything. They don't feel a lot of pain. They just feel a little twinge. And they're like, oh, that's it? We're done? It takes like 5 minutes to do. It's so
Wow.
quick.
Wow. It sounds like such a kind of simple thing that can affect your self-confidence,
Yeah.
your just comfort in general,
Yeah.
your relationship,
Yeah.
I mean, it can help in so many different ways.
Yes.
Wow.
Yes.
So how many treatments do you usually need to have?
Good question. We recommend 3 treatments, one
Okay.
month apart. Three
Okay.
treatments, 1 month apart. And then because as we age, the body continues to age, we recommend a maintenance treatment once a year after that.
Okay.
So 3 treatments, 1 month apart, and then once a year maintenance after that.
Ah.
Yeah.
And um, how I had a good question and I
It'll
lost
come
it.
back. It happens to me too.
Because I am approaching menopause and I gosh, what was I gonna say? I don't know. I'll come back to it.
It'll come back.
But
Yeah.
yes, yes. But it is really, really fascinating because I think so many people do just kind of live with it.
Yes. Yeah.
And the
And
pub go ahead.
go ahead. Go ahead. Sorry.
No, I was going to say that with the pelvic floor therapy, too, it's interesting. Like we all want a quick fix, right? And not something that we have to work really
Work.
hard for. And
Yeah.
this, not again, like you said, probably in conjunction with pelvic
Mhm.
floor therapy for most people. It's not that you shouldn't still do the pelvic floor therapy, but it might give you a quicker fix than that
Perfect.
alone,
Yeah.
potentially.
Because pelvic floor therapy is usually a 12-week stretch.
Hmm.
And I had a patient who just could not make it there. Her
Yeah,
work schedule, the therapy place was only open till 7 p.m. Maybe she worked in the city and had to come to the suburbs. And so she's like, Doc, I cannot get to these appointments. So I was just
right.
like, it's good to have. It's just really, I guess boosting for me as a physician to have
Hmm.
options. When we exhaust everything and I'm like, I can't help you, that kind of defeats the whole purpose of you coming to me.
Right,
So I'm
right.
always looking for solutions. That's something I'm always I pride myself on as a doctor, looking for what are people doing, what's going on out there, that
Hmm.
and that's also the flexibility of being a private physician, having your own practice, because you can branch out, you can explore, and you can find treatments that are safe and effective for your patients.
Right, right.
Um,
Yeah.
yeah, but yeah, and the pelvic floor therapy requires continuous work,
Hmm.
because if you don't exercise that muscle, it loses its strength. So this is an advantage that the laser has over the pelvic floor.
Right, right. And it may just optimize your pelvic floor
Pelvic floor
therapy,
therapy,
right?
exactly.
So it gives you that extra boost, like you said, to maybe make the pelvic floor therapy work a little
Work
quicker or more
quicker.
effectively. And
Yeah.
and not and we're not knocking pelvic floor therapy. It's so
Absolutely
important
not.
and it can help in so many different areas of your body. So, it's still very important to work
Very,
on that.
and I still recommend it. I, give
Yes.
out the referrals every day, uh,
Yes.
to my
Yes.
patients. Yeah.
But when it's not working or it's not working enough
Mhm.
or for whatever reason,
Mhm.
yeah,
There are
that's
options.
that's great. I remembered my question.
Oh,
So,
yay!
any risks?
None whatsoever. So
Oh,
the there are a few things, I'll go over your medical history before I do a treatment. So there are a few things.
yes.
Someone with an abnormal pap smear with active HPV, we would not want to activate that.
Right.
So such an individual would not be a good candidate at that time. But
Okay.
as we know, your body can clear HPV. You can have procedures to clear that cervix if it continues to be abnormal. People with active herpes infection, and so we usually recommend people get like testing, their pap and their vaginal infection testing before they get that done. Otherwise, no contraindications. There's nobody that's not a good candidate for, because it's non-medicinal. It's not a surgery. It's just a
Mhm.
little tiny probe.
Mhm.
People don't really have any symptoms afterwards. We tell them nothing in the vagina for 3 days, because we want all that work to happen. We don't want to interrupt that process. But after that, I free them to do whatever they want to do. No downtime. So you can go right back to work after the treatment. You don't
Okay.
have to take time off work or sit in one place for 2 minutes or anything you want to do. You can go live your life.
Yeah.
So yeah, no risks, no side effects. Just
Wow.
we do
And
our due
even
diligence to make sure
yeah.
you're a candidate. Yeah.
Okay. And even if you are breastfeeding, there's no risks
No
to your
risks if you're breastfeeding.
baby. Okay.
No risks if you're breastfeeding. It's a local treatment,
Right.
vaginal local treatment. Yeah, it's like
Right.
giving someone who's breastfeeding vaginal estrogen. And that's what I
Yes.
used to do before I had the laser is, women who are breastfeeding, sex has become painful. We tell them to use a lubricant. Sometimes I give them estrogen and they're like, it's still not
Mhm.
comfortable. Then the laser therapy is a really, really good option for them.
Yeah. Okay. Wow. That's such an amazing service that you are providing. And, in such a unique environment to just have your practice where people can feel comfortable and feel comfortable talking about these things that can sometimes be very difficult to talk
Mhm.
about.
Yeah.
And if you guys have all noticed, one thing that I have found about Dr. Durowade is she's just a down to earth, smiling, always smiling
Thank you.
person who you can feel comfortable with so quickly.
Yeah.
And, it's, if you're not on the south side of Chicago already, I think she's worth the drive.
Thank you. Yes.
And, just amazing, amazing things that you're doing.
Thank you so
So
much.
great.
Thank
So
you.
tell me about the open house.
Yes. Oh, I'm so excited. And it was the devices that it was the laser device that prompted the open house. I'm like, people
Okay.
got to know that we offer this now.
Yeah.
Um, and so it's tomorrow, Saturday. It's from 10 a.m. to 4 p.m. So anybody can just walk in, eat some food, have a nice conversation, see the devices. So when you were saying in action, I was like, I don't think we can.
Nobody's going to volunteer
Nobody's gonna
to have an audience. Okay.
No. um, but they'll see the device, they'll see the probe, and we can. A few of my patients are going to be there who've actually had the therapy. I asked them if they'd feel comfortable talking about it, and they said absolutely. So they're
Yeah.
going to come. They can talk your audience, so anybody who'd like to come can talk to my patients who have gone through the therapy, their experience and their results. So I'm
Okay.
really excited to let everyone in the Chicagoland area know that we now offer this, and we're in Homewood, Illinois. So if people don't know, the suburbs is close to Matson, Illinois. It's close to Olympia Fields. Maybe another place is Frankfurt. So just around those south suburban areas is maybe Tinley Park, Orland Park, maybe 15 minutes from Tinley Park is our clinic. And you can just walk in, chit chat, see the device. If you'd like a consultation, I can even do a consultation tomorrow. So
Wow.
we can go into a private room, talk about your
Okay.
history. If you've had your pap somewhere else, I'll get the records and stuff like that. So we make it pretty streamlined and pretty easy for people to get the service. So
Oh,
yeah,
great.
tomorrow 10 to 4.
Great. Yay. So exciting.
Thank
Now,
you.
are there other things you can use the laser for? I feel like
Yes,
yeah, yeah.
100%.
I'm curious
Because
to
it's
hear
a
about that.
CO2 laser, so you can use it for C-section scars that people don't like.
Oh,
So it can do skin resurfacing.
okay.
It's mostly for people with brighter skin tones, but for the C-section scars, you can use it for anybody, any skin tone, because you're focusing on the scar itself.
Okay.
But for women with brighter skin tones, for wrinkles, for aging spots, for rosacea, all the redness and
Yep.
discoloration, yeah, it's a CO2 laser you can use for skin resurfacing. Um,
Okay.
because I'm gynecology, at some point I plan to branch into that.
Okay.
I can do
Okay.
C-section scars, but it's like the dermatology part that I you know, I might need an esthetician or someone to help me with that one.
Right. What about, I did see some of your videos about hair loss.
Yes. So that's
Yeah.
a different device.
Oh, okay. Well, tell us about it.
It's called the TED.
Okay.
The full meaning is transepidermal delivery. So
Okay.
we're using a machine to deliver a hair serum into the hair follicle. Because a lot of people treat hair loss with topical treatments or
Mm-hmm.
sometimes the PRP injections, where they inject the medication directly into the scalp, which can be very painful.
Yeah.
And the wild one is the hair transplants, that people get surgery to get hair transplanted on their hair.
Yeah.
So we found an easier way, basically. It's a machine that delivers sound waves to the scalp. And
Okay.
it basically allows the strict barrier of the scalp to shift a little bit. So you can get the hair serum in and get it down to the hair follicle. It basically opens up the pores of the head.
Oh,
Instead of just
wow.
rubbing the cream in,
Yeah.
we deliver it directly to the dermis. And so people see faster results. So instead of 6 months that we got to wait for the life cycle of the hair follicle, you're getting it down within a month. I mean, you're getting
Wow.
results within a month because
Right.
you're getting the hair directly to the hair follicle.
Right.
And so women who have like postpartum hair loss, this is a fantastic option for them. It doesn't interrupt their breastfeeding. It doesn't interrupt their lives. No downtime, no surgery, no injections. For women with postpartum, post-menopausal hair thinning, a lot of women, their hair starts thinning. It helps to build up the fullness of their hair. And so when I was looking into buying devices for the office, I'm like, what's going to address the issues my patients are facing that I currently cannot help them with? And I said, I have a lot of postmenopausal women with hair loss. And, I used to treat that with estrogen and, the minoxidil
Mm-hmm.
treatments and the 5-alpha. There's another one from the dermatologist that helps to keep the hair. But one of my patients had to come off her estrogen because her mammogram looked concerning. And then the hair loss resumed. I was like, oh my
Mm.
God. And then she called me. And I was like, what am I going to do for her? I don't know.
Right.
So now that I have the TED, I'm really excited to have options to give those women. So yeah, it's very exciting.
Yeah.
And that one we can see in demonstration tomorrow because you don't
Okay.
need
Right. It's not quite as
it's not, yeah,
personal.
not as personal. That one will show, and anyone can volunteer. We'll do throughout the day. Anybody walking
Okay.
in who wants to give it a try can get it done
Okay.
tomorrow.
Wow. So, after doing this, everybody's going to come to you who just has a problem that hasn't been solved of any type and hopes that you can figure out an alternative.
That's awesome. I like being the innovator.
Yes, I'm writing down my list right now. Watch out.
Wonderful.
Wow, this is just amazing. I am so
Thank
glad to
you.
have you as a resource for my
Thank
patients
you.
and just as a colleague to learn so much about other things, common
Yes.
things that no. How did you put it?
Yeah.
I love the way you
Uh,
put it.
things that are things that should be common
Common,
but
but
remain
remain
uncommon.
common. Yes,
Yeah.
yes. Very, very good way of saying that.
Thank you. Thank
Couple
you.
more questions real quick. So one is, and you are a Chicago person. So what is your favorite Chicago thing? What do
Interesting.
you like to do most in Chicago? Land.
I love to go to Chinatown. I love
Okay.
there's so many restaurants there,
Yep.
and I love for some reason, I don't know if you saw it in what I sent you. Um, maybe because it's similar to because I'm Nigerian, maybe it's similar to Nigerian food. I love Asian food. So
Okay.
Chinese food,
Mhm,
Thai food, Korean food,
mhm.
Japanese food. So I would just go to Chinatown and try the different restaurants and say, "Oh, we went there last time. Let's try this one." So I love going out to restaurants down in Chinatown and trying the different restaurants there to eat. So that's one of the things I like to do.
All right. I know where I'm going to meet you for our
For our hangouts in
Yes,
Chicago.
yes.
That would be funny.
I remember going as a kid and, having the middle thing that you roll around, like the lazy Susan, and
Yeah. Oh, yeah.
uh yeah, that was always a big treat as a kid. So,
And
and I
the
don't do
dry
it as
spell
much
festivals
as an
too.
adult, so we definitely need to do that for
Yeah.
sure.
Yeah.
Okay, so that's a good one, Chinatown. And if you had the opportunity to go
Mm.
back and talk to your 20-year-old self, what
Wow.
would you tell her?
I would tell her, that's a great question, by the way. And I feel like I have thought about this a couple times, and someone has asked me this a few times. So I've had a chance to think more about it. And I think
Yeah.
I would tell her to dig into her network and not put so much pressure on. I can speak in the first person instead of the third person. Don't put so much pressure on yourself to do everything.
Yeah.
You know, take advantage of the people around you. You know, cultivate those relationships. Don't. I was so focused. Oh, I got to be a doctor. I have to do this, and I have to do this. I have to. I was just a task oriented person. I should have spent more time with people. I should have built more relationships, built a larger network. And yeah, school is important, and school got me to where I am today. But what sustains you is your network. What sustains you are
Yeah.
the people around you. And thankfully, I have a good personality, so I can make new friends. And my old friends are loyal, but wider network.
Yes.
Spend more time, make the effort to develop those relationships. Don't just say I'm busy, I'm in med school. They'll understand. Cultivate those relationships, build them up, keep in touch. Oh, keeping in
Ah!
touch. How
It's
awesome is
all
that?
connected. It's all connected.
That's fantastic. Yeah,
Yeah. No, that's
I
really
would
good
say.
advice. And that's, it's kind of what you're saying is also just like ask for help. And you don't, like you said, you don't have to do everything alone. So maintain those relationships, but even like don't be afraid to reach out when you really are
When
in
you
a
need
place
it.
where you need that help.
Absolutely. Yeah.
Bec-
So,
I mean, and I'm telling that all the time to my postpartum moms
mm,
who and families who,
mm,
if somebody offers you help,
yeah.
don't say
Take it.
no,
Yeah.
because this is the time when you need it and you will help somebody else when they need it, but
Mhm.
take the help and ask for it
Absolutely.
if it's not being offered, because people
Ask for it.
sometimes don't know, they're not going to
Yeah,
know
you're not
unless you
gonna know
say
unless
it.
you ask. Yeah,
Right, right.
absolutely.
Very good advice. You are very wise.
Thank you.
So, I have really loved this conversation. I'm
Me
so
too.
glad I now kind of understand what this laser is and how it can help with vaginal issues. And this is such a great resource.
Thank you.
So, if there are people watching who want to reach out to you
Mhm.
and either come tomorrow to the open house, remind us about that, the
Yeah,
details, and I will put it in the notes. But and also just how can we reach you if we
yes,
want to see you as our gynecologist or for specific issues?
absolutely. Dadurmedical.com. That's my website.
Okay.
DARDUR medical.com. Or you can send me a message on Facebook, Dadur Gynecology, or on Instagram, Dadur Gynecology. Or on Google. If you just Google Dadur Gynecology, there's a chat button. You just send us a chat. We have this system that kind of gets new messages. And so someone is always stalking that page. Someone will get back to you right away. So through any of my social media platforms or through Google or through my website, dadormedical.com.
Wonderful, wonderful. Thank you so
Thank
much. It
you.
was
So
such
fun.
a pleasure. And thank you so much for providing these
Absolutely.
services for women in the Chicagoland area. We need more people advocating for
Mm,
women's health.
I agree completely.
Yes. Ugh. All right. Well, you go enjoy your Friday, and
Thank you.
um, I will, again, I will put all of Dr. Durawade's information in the notes from this event, and you can watch the replay. If you are watching the replay and you have questions for either of us, you can put them in the comments and we will absolutely get back to you. So don't hesitate. And have a wonderful weekend, and we will see you next week on Keeping in Touch.
Bye.
All right. Bye-bye.